Everybody hear me okay? All set. Okay, awesome. So thank you for having me here. This is my favorite thing to talk about. And what I'm going to do tonight is kind of talk about what motivational interviewing is, how you do it a little bit, and also talk about some of the research I've done with parents of individuals with serious mental illness, so that you can get a sense of how people have used it. So I'm going to share my screen so you can see my slides. Okay, perfect. Okay. So as John said, I'm a psychologist and I'm the co-director of the Psychosis clinic at Boston Medical Center. And I learned motivational interviewing in graduate school. It was not really like my focus of what I studied, but once I got out into the postgraduate school world, it was like the one thing I remembered and used all the time. And I found it was just the best tool that I had. And over the years, I found myself working with populations of individuals with serious mental illness and feeling like, I see this person an hour a week or every other week, and they are or aren't gonna sort of do what I recommend. But the person who can really have this conversation is the person who's living with them, because the family members are observing day-to-day behavior and they're really on the ground when it comes decision time, decisions large and small, take the medication or don't, take a shower or don't, go to the party or don't, whatever it is. So I was able to get some funding from the Massachusetts Department of Mental Health and also the National Institute of Mental Health to develop this content, to pilot it with a number of families and see if it made a difference to them. So I appreciate all of those people who were willing to be part of this research. I don't have any commercial interest. So motivational interviewing is a mouthful. And it was developed by psychologists in the 1980s who were working in addictions, really with the idea that they weren't getting anywhere with a sort of confrontational approach where you argue with your patients and tell them, you really need to quit drinking. Don't you know this is ruining your life? They found that sort of a less directive approach that was a little less confrontational and more based on sort of the idea of a partnership was much more effective. And they were able to sort of operationalize that in a really interesting and specific way that was incredibly useful for the field. So it was really developed with the goal of increasing motivation for treatment amongst people with substance use disorders. But, over the past 30 or 40 years, there's been a ton of research showing that you can use motivational interviewing very effectively for all kinds of behavioral targets. So things like medication adherence or just showing up for treatment, nutrition, exercise, those kinds of things. And really the idea is this partnership idea. And the reason they chose the word interviewing is because it doesn't suggest any particular power dynamic at all. It's just two people having a conversation with one person, sort of guiding the conversation through their questions and their interest, and the other person talking about things that are important to them. And it's really based on the idea that our influence derives mostly through our relationship and also through our ability to get people to envision change for themselves and think about their own motivations. Because I might want you to do something, and that may actually have very little bearing on your behavior. So I started using this with parents, and in my studies, it was mostly parents of young adults who were going through serious mental illness, sort of between the ages of, say, 15 to 35. And what they found is that most of them had already been they'd tried a gamut of approaches from sort of very sort of passive, like, well, they'll grow out of it, there's nothing I can do, to something very controlling, like, we just have to put our foot down, put an end to this nonsense. We're going to be really strict this time. We're going to make sure he takes the medication and doesn't smoke any marijuana and goes to the appointments. And they were really driving themselves crazy because neither of these approaches were working to help their kids. And it's a tough spot. You desperately love and want to help this other person, one of the most important people in your life. And they're making bad decisions and you just can't control them. And I think a lot of people feel like I should be able to control them. If I were a good mom or dad, I would be able to control them. And it's just not true. We just simply cannot control other people. And that's something that's actually hard for psychologists in training to accept as well. We feel like, well, we feel responsible for somebody else's choices in a way that really doesn't make any sense. We can only control our own behavior. So if we used an evidence-based approach, we can at least feel good about, I did my very best. I brought my A game to the situation. And of course, the other person's going to go home and figure out what they're going to do. The other thing that's nice about motivational interviewing, both for therapists and for family members, is that it's a great way to establish and enrich connection, even if you feel like, okay, this behavior change I want this person to make, whether it's, quitting smoking or getting a job or taking medication, whatever it is, that feels a long way off. But at least when we talk this way, we're not arguing. We're getting a little closer to the goal of just sort of positive connection. So I got the sense that family caregivers would be really interested in this and develop this curriculum that it's not teaching by the book motivational interviewing. It's sort of translating and adapting some of the skills in a way that, will feel relevant and hopefully organic for families or other caregivers. And so, take whatever you want from it. There's no right or wrong way to do this. And by this, I mean, have a relationship with your family, of course. I'm just going to give you some tools. And if any of them feel like they would be a good fit, go ahead and try them out. So I'm going to kind of go over what motivational interviewing is or isn't. And like I said, really the first thing you have to do if you want to do this is challenge that sense that you need to control other people and that's the best way to help them. So that's hard to do because when we see someone who we love struggling, we want to help them. And I want to just play a short video that kind of gets this point across. So just give me a moment to cue that up. Okay.
It's just, there's all this pressure, and sometimes it feels like it's right up on me and I can just feel it, like literally feel it in my head, and it's relentless. And I don't know if it's going to stop. That's the thing that scares me the most, is that I don't know if it's ever going to stop.
Yeah. Well, you do have a nail in your head.
It is not about the nail.
Are you sure? Because, I'll bet if we got that out of there.
Stop trying to fix it.
No, I'm not trying to fix it. I'm just pointing out that maybe the nail is causing.
You always do this. You always try to fix things when what I really need is for you to just listen.
See, I don't think that is what you need. I think what you need is to get the nail out.
I'm not even listening now.
Okay, fine. I will listen. Fine.
It's just, sometimes it's like there's this achy, I don't know what it is. And I'm not sleeping very well at all. And all my sweaters are snagged. All of them.
That sounds really hard.
It is. Thank you. Ow!
Oh, come on. If you would just
don't
try to see things.
Okay. So I don't know if that video resonated with people. Would people do me a favor? It's helpful for me to just know if my audience is with me here. Could you just put a comment in the chat if that resonated with you. And especially if there's a topic in your family that feels like a nail in the head. What is that? You know, is it taking medicine? Is it, you know, drug or alcohol use? Is it going to sleep at a, you know, having good sleep schedule? I'm curious to hear. Taking medication, exercise, yeah, sleep schedule. Yeah, great. Yeah, and it's like it's the solution is so obvious to someone who's observing. And yet, pointing it out is just like for some reason so unhelpful. Um, so I'm also curious if anybody has ever been on the flip side of that, where somebody was giving you advice or trying to solve your problem, and you were like, okay, you know what? I don't need to hear this right now, even if maybe they were right. And it's just something to think about if you can ever remember an experience of getting advice that just did not feel so good. And if you want to, you know, put it in the chat or even, you know, unmute yourself for a minute, you know, go ahead, because I think it's valuable to think of yourself on both sides of this situation. So people are talking about dealing with their own parents, it looks like. Mhm.
Yeah,
Great.
lots of different comments.
I wonder if it even especially comes up, you know, if you all have been vulnerable to this because everybody thinks they know something about what you should do with your kids, you know, and people are giving you unsolicited advice, and that doesn't feel good. Like, you know what? This isn't something that could be solved overnight. So I think it's, you know, useful to think about why that feels bad to get advice. Like, why don't people appreciate it when we try and solve their problems for them? And I think it's because, yeah, I see a comment in the chat that says, I want to be comforted, not advised. And I think that's true for a lot of us a lot of the time. You know, we do want to change our situation, but first we need to feel comfortable. We need to feel at ease. And sometimes getting advice gets in the way of that. So in motivational interviewing, we call this the writing reflex. And it's that impulse that when you see somebody having a problem, you try and help them by doing one of these three things. You either just try and get in there and fix their problem for them. You try and give them advice about how to solve their problem, or you minimize their issue and you say, you don't really need to be so worried about that. You know, you're making too big a deal out of it. So, you know, saying, oh, you need to get that nail out of your head, or just, yeah, I've had parents who I watch this video with and they go, oh, I would just reach out and yank it myself. You know, just going ahead and fixing the problem without permission. These things are manifestations of our writing reflex. And the writing reflex is just an empathic human response. There's nothing wrong with you if you have a writing reflex. It just means you care about somebody. But it can get in the way of change. So yeah, people, it's nice to have these reflections in the chat. That, you know, sometimes the problem is more complicated than the other person can appreciate, or, you know, it's just not relevant advice. They don't understand the complexity of what you're dealing with. So I want to give another example, one that's a little more subtle. And this one comes from one of my research studies. So one of the things that we did with all of the family caregivers who participated in one of these studies was we wanted to get a sense of what their sort of problem solving approach was when they came into the study versus after they got the coaching sessions. So I'll tell you what you're about to hear. what this woman here on the screen is, she used to be my research assistant. Her name is Simone. And everyone on the team had certain situations they would use that were like standard, and it was real. It was real. Like we used things from our own lives, so that there was a sort of organic quality to the conversation. And what we would do is we would explain to the person who was coming into the study this dilemma that we were facing, or a change that we wanted to make, but for some reason had been struggling to enact in our lives. So it might be going to the gym more. And you're going to hear Simone talk about how she wants to she was at one point in her life very passionate about dancing, and she wants to get back into it. So she's thinking about going back to dancing, but she hasn't been able to do it. And we didn't give the parents or the caregivers a lot of instructions. We just said, help us resolve the dilemma. Let's just have a conversation about it, just so we could get a sense of, where people were at when they came in. So I'm going to give you an example of a parent who was incredibly brave and generous. A lot of the parents said we could use their audio for teaching and presentations. So this parent was so kind to volunteer that. And you're going to hear a little bit of that writing reflex, and it's not like, nail in the head. It's a little more subtle. So I want you to hear that. So I'm going to pull up the audio clip. It's about 2 minutes long.
So my situation is that I am hoping to get back into dancing. I want to audition for a local dance company next month, but I have some reservations about it. I've danced my entire life, and that itself has been really positive for me, but the social atmosphere that kind of comes along with jumping into unfamiliar dance environments has been both positive and negative for me in the past. And these experiences have made me distance myself from dance, even though I love it and do miss it. So I'd say like I do really like going with friends, which that has been positive in the past, finding someone to go with me. But I would like to not have to necessarily rely on another person to go. But it seems like that is kind of something that's gonna ultimately make me. That's where I'm at.
All right. All right. Well, I think it's great that you're gonna start doing dance again. That's really wonderful because you're so good at it. And I would just recommend you're always gonna come upon people that are different. Sometimes if you just start on through, the first day, and even if you're scared, just keep going. Think of the way it makes you feel when you're dancing. And that would be, and hopefully as you're plowing through, it will take away any insecurities, by facing it straight on.
Yeah, I think that I think it's just a matter of, I don't know. I just don't have the motivation. Like, I'm motivated to go, but one, there's a pandemic, so I can't do anything right now. It seems like, but two, I feel so strongly about all of this stuff that I've encountered before that I just don't even know how I could even get to the point where I could go.
Okay, so sorry about the interruption. Hopefully you can still post the video. Yes, the trials of working at night from home. So what you heard in the clip, I'm curious if people might want to weigh in a little bit on what they heard, like any observations of sort of what the parent was doing and whether it was effective, and I can say what I heard, which is that the parent here is incredibly kind, very encouraging, and is kind of like a cheerleader. She's like, just do it. It's going to be fine. And it kind of is falling into that category of like giving advice and also maybe minimizing the issue a little bit. And as she talks, Simone seems to actually become less interested in making the change, right? She starts backing off. from what she initially said she wanted to do. Yeah, and it wasn't egregious or anything. I mean, she wasn't being condescending. She was just being really nice. But it had sort of the opposite effect as maybe she intended. Okay, so what is the opposite of that? You know, because now that we know what motivational interviewing isn't, I want to, you know, not just make people feel helpless, give you some tools to understand what it is. So here's kind of the philosophy, is that in order to get into that place where we actually can consider making a change, and this isn't just people with mental illness, it's not just young people, I think it really is everybody. We need to feel understood, confident, and in control. And let me drill down into each of these a little bit. So understood meaning that we're appreciated as an individual, we're not being judged or labeled, and that the complexity of our individual circumstance is appreciated. You know, somebody's not saying, you know, just treating us as a type or something like that. Confident means that this change that I'm considering is something I could actually do. You know, if you told me that in order to get in shape, I need to run 10 miles every day, that is just not something that I feel confident about. And right away, I feel like, well, there's no way I could do that. You know, confident means something that, you know, I could do that. That feels within my power. And in control is pretty obvious. It just means that when we feel pushed, we often push back. And, you know, people will do really stupid and self-destructive things just to prove that, you know, nobody else can tell us what to do. So, interesting. I'm seeing a comment about the encouragement. Yeah, that for some reason encouragement can get on people's nerves. And it is like such a mystery. Like, why is that? But it's a great comment. So how do we get somebody to feel understood, confident, and in control? Well, one way is just to not give advice right away, though people often do need our advice. Our kids need our advice. They don't know as much as we do, and they might not be thinking very clearly about a problem. So how do we get them into that mind space where they're able to hear and accept our advice? So the first tool I want to give you is something called a reflection. And this is really the most basic building block of motivational interviewing. And it is so simple. The idea is that it's a statement, not a question. It's specific to what the other person's saying. And all you do is you just repeat back what you heard them say, or you take a guess at the meaning or feeling underneath. And you're helping the person feel understood and accepted, and also hear their words reflected back to them. And so they can think a little bit more deeply about whether they meant what they said. So here's types of reflections. Simple is where you just straight repeat back what you heard. And this can be good when you're feeling a little overwhelmed. You're not sure what to say. Complex is where you're reflecting like the gist of what you think you heard or the meaning. And a feelings reflection is like where you don't even repeat back what you're hearing, just the feelings. This is kind of like customer service 101, where you're like, oh, wow, I can tell you're really frustrated. But it actually does really work. And back to that point about praise or encouragement, an important part of reflections is that they don't judge at all. They're completely non-evaluative. So you're not saying whether you agree or disagree, whether something is good or bad in your estimation. You're just reflecting it back. And if you want to put a little daylight between yourself and this statement, you can say, so you're saying that blah, 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 blah. Or it sounds like XYZ. You know, you're not agreeing with it. You're just reflecting. So here's some examples. If someone said, well, using marijuana is legal, not a big deal, just get off my back. A simple reflection is you feel like it's not a big deal. A complex reflection is, so smoking seems normal to you. And a feelings reflection would be like, my concern is annoying to you. And you hear how my voice goes down, like it's a statement. I'm I'm not challenging it. I'm just reflecting it back. Here's another example. So if somebody said therapy is dumb, you could say therapy is dumb. Or you feel like you're not getting anything out of it, or you're feeling frustrated. So those are reflections, and it's not the whole conversation, it's not going to be reflections, but it's a way to slow down and make sure that this other person who you're talking with is feeling understood. So if people want to try it out for themselves, I'm going to put an example, a statement up here. And if you have an idea for what might be a reflection, you can put it in the chat. So if someone said psychiatric medication is a scam, what would be a reflection for that statement?
Maybe you think psychiatric, so you could say, you think psychiatric treatment is a scam.
Yeah, that's a simple reflection. Perfect. Or here's a good one. You don't believe medicine works. Or it sounds like you don't have any confidence in the medication. Great. You don't trust the meds. Those are good reflections. And even if the person is not thinking clearly, if they're having delusions, if they're paranoid, this is still a good way to help them feel understood, because you might want to challenge their belief, but you will be so much more effective in doing that if you do this first. Okay, so we're going to get kind of to that step where you might give some advice or offer a gentle challenge or say, well, what I think is this, but this is, you know, you're laying the groundwork. You're like, okay, is this person feeling understood, confident, in control? Let me make sure they are. Okay, so here's another one. I've tried to quit smoking and it never works. What would a reflection be? Go ahead and try typing something in the chat. You're frustrated with trying to quit smoking. You feel like you've done this 100 times already. It's very hard. Yeah, perfect. Yeah, you've tried it before and it didn't work. It must be so discouraging. Those are perfect reflections, right? And again, you might want to offer some advice or some encouragement, and that's going to be more effective if you save it. And just do this first. All right, so somebody put a question in there, and I want to talk about questions next. Because questions are also, I would say it's like the other building block of the technique is asking curious, good, non-judgmental, open-ended questions. And, you know, the most important part of the technique when you ask the question is that you're not like on Law and Order. Okay, you're not like trying to prove a point. You're not a lawyer trying to make your case. You're genuinely coming from a place of curiosity. Wanting to understand how this person is thinking and what's motivating them. So here's an example. If somebody said, well, I'm not going to see that doctor again, some questions that might come to mind for me would be, well, what happened last time you met with her? Or help me understand where you're coming from. Or what do you see as the pros and cons? You know, as opposed to, oh no, you know, I searched far and wide. This person is a specialist. We were on the waiting list for 4 months. You saw her once. You are absolutely going back, which is an understandable reaction. And again, you're going to be so much more effective with that if you can slow down and do some good reflections and ask some questions first. And the idea is to ask an open-ended question that conveys non-judgment, interest, and gets somebody talking. Asking open-ended questions is actually harder than it looks. It usually takes people a good amount of practice to get good at this. And I do want to put a caveat here that when you're talking with somebody who's who's experiencing serious mental illness, sometimes open-ended questions, you know, can be overwhelming. So, you know, sometimes people do need like a little bit of a simpler kind of concrete yes or no. When you're talking to somebody who's really in the thick of serious mental illness. But in general, open-ended questions are the ones that start with like a what or a how and really get somebody to give those more descriptive answers. So here's some ideas for like transformations. So instead of saying, are you feeling better today? You know, the answer is kind of yes, no, maybe. You could ask, what did you do today? You know, it gets that more descriptive answer. Instead of, did you take your medications? What's going on with medications? You still just might get a, it's fine. But at least you've invited a little bit more of a conversation. Instead of, are you going to that appointment today? You could say, how has therapy been going? Or what do you see as the pros and cons of meeting with your therapist today? Instead of doing neighbors, let's do chat. So try to think of an open-ended question and put it in the chat. And I'm going to use the same example. Psychiatric medication is a scam. What's a question you might ask? How so? Great. Tell me more about that. Those are great. Yeah. Where did you hear this? Okay. What's been your experience? That's very curious. That's lovely. What makes you say that? What makes you think that? Great. Are there any meds you've had a good experience with? Yeah. I would just caution against like kind of going to the good side too fast, you know, because you want to make sure you're staying with them, maybe in the commiseration for a couple minutes, right? Even though it's uncomfortable for us, I think, because we want to convince somebody, hey, give this a try, but you know, let them air their grievances. I think it's important for all of us to be able to vent a little bit once in a while, and then, you know, ask that great question, have you ever had a good experience with medication? And then here's the other example. I've tried to quit smoking and it never works. What are some questions you might want to ask? What happened last time? What have you tried? What might work for someone else? Yeah, what have been the barriers? Great. Great. Yeah. How have you felt when you've tried? What, you know, do you really want to maybe we could change that to be a little bit more open by saying like what are the pros and cons of trying again? Or what would be nice about quitting smoking? Or what made you want to quit in the past? Great. Okay, so we have reflections, we have curious questions, and I want to give you one more tool, which is, you know, that point in the conversation where you feel like, okay, I've listened, I've really suspended judgment, I've sat on my writing reflex for like longer than I was comfortable doing. Now I want to try and help this person find some solutions. So here's 3 strategies for doing that. The first is to try and recognize past effort, because people are experts on their own experience. So you might say, well, what happened? Or what did you already try? Have you tried solving this problem in the past and what happened? Or you could ask a question that's like, what are your ideas for solving this problem? So what could you do? What do you think would be helpful? What could you try next? These solution-focused questions, you know, how do you want to handle this? And even if you have very low faith that they're going to be able to come up with any good ideas, it's nice to ask, because if it comes from them, they're more likely to follow through on it. So, you know, you can take a gamble and just see if they have any ideas. If they don't have any good ideas, or if, you know, it's just becoming really clear that you have the information or the advice that they need to hear, Now it's time to jump in with that. And it can really help to do this and make the person feel more receptive to the advice if you label what you're doing. So you can say, can I share some ideas with you? Or, I went through something similar, or your sister went through something similar. Can I tell you what worked? And, we do this in the clinic by saying, well, what you're saying is very individual, very specific, but we treat a lot of people with similar problems. Here's some of the strategies that we recommend, or here's some of the treatments we recommend. Yeah. So there's a comment in the chat that I want to address that's like, if you feel like nothing will help, or if the other person feels like nothing will help. And I think that I like to do a reflection when I hear like hopelessness, helplessness, because it often at least will help the person feel less alone, like somebody's listening to them. And sometimes it will help turn the conversation around, though not always. And what this sounds like is, if you say, well, what do you want to try next? And they say, ugh, nothing. I'm just, I'm never going to quit smoking. It is what it is. And, a reflection would be, so you don't think anything's going to help you, or nothing will ever change. And that's just, I'm reflecting that hopelessness. And sometimes that in and of itself, it's like, I didn't, the person almost invited a tug of war game around this behavior change, and they pulled their end of the rope. And instead of pulling my end of the rope, I just put my end of the rope down. I walked over to them and I went, oh, wow. Yeah, that's quite a rope you have. Right. And it's like, I'm not going to argue. It's okay. Like, I'm not here to argue with you. You're feeling hopeless. I don't want to make you feel worse. It is what it is. I hear that. And sometimes that will get the conversation moving in a more positive direction. Actually, you can try it and see if you have any success with that. Yeah. So those are the 3 tools that I kind of recommend, though tool 3 is pretty complex and there's a couple different tools built into that. And I want to give you a sense of what this sounds like in action. So we're going to go back to Simone, and this time talking with a different parent. And this parent had just done the motivational interviewing for loved ones training, and she was trying out her skills with Simone. And we never had the same parent talk to the same person twice, because that would feel really artificial. Like, well, we already talked about that. So, we would always mix it up. So this parent has not heard Simone's dancer dilemma before. She introduces it in the exact same way. She's literally reading off a page and she says, oh, it's been positive for me in the past, blah, blah, blah. And this time the parent, instead of jumping in with some advice, says, okay, well, tell me more about why you quit dancing. And that's where we're gonna pick up on this 2-minute clip, which I just love. So let me pull that up for you. All right, and see if you can find those 3 things, reflections, open-ended questions, and finding a solution.
It was like, I'm growing up. I don't like my body as much as I used to. It doesn't do what it used to do. And then, like, I don't get to dance anymore anyway because of all the issues. So I'm quitting that entire part of my life unwillingly, but for myself and for my own mental health. But then, I couldn't find a way back in.
Yeah, no, this sounds really, really important to you, to both, your physicality, your body, and also, just the emotional experience of being close to people and close to people who are as serious as you are.
Mm-hmm.
That is what I'm hearing. And structure as well.
Yeah, I'd say you hit all of them. Perfect, spot on.
Yeah. So what do you think that you could do?
I honestly don't know. I've had this conversation before, and I think I really was like very passionate about that dance piece. But now I'm wondering if I can, kind of thinking about those fundamental things that I care about, like structure, seriousness, kindness. I'm wondering if I can find an active group-based thing that allows me to get all of that, all of those things met. But maybe it doesn't have to be dance. And I mean, I do love dancing, but I also, I don't know, maybe that chapter kind of is closed for me. And maybe that's why I'm having such an issue getting kind of started back up with it, just because maybe I should just move to kickboxing. It's like a structured thing with the teacher that's going to be kind of encouraging us, and I'm sure that the people around me will be doing the same. So, and I'll be able to form relationships and meet people. Maybe I should look into that. I'm actually looking that up right now.
That's so great. Oh, that's exciting to hear.
Yeah,
it really
thank
is.
you. That was really helpful.
All right. So Simone was so great at these because she really she would really be very real with the parents in either direction. If she felt like it wasn't going well, she'd be like, no, I'm not going to do that. But if she felt, the right kind of encouragement or openness, it would really show in the conversation. So this is a nice example because I think, the kickboxing is not something, it's very out of the box. Like I would have never given her that advice. That would never have occurred to me as something that might solve her problem. But it's, for some reason, once she had the opportunity to think it through with an audience who was caring and supportive and not pushy, non-judgmental, that was something that occurred to her as something that would be very helpful. And I can, give you an update that she did not stick with kickboxing, but she did, I think she, got into thinking a little more flexibly about solutions to this problem. And she's doing this like really cool, like aerial trapeze thing now. It's very neat. She puts videos on Instagram and they're very beautiful. Hopefully you can kind of hear the difference in the tone of those conversations. Like the first one is a little pushy, and then the response is like, hey, back off. And the second one is more kind of light and curious and interested, and it generates some action, some motivation. But the skills is what I really like, because I am a fake it till you make it kind of person. And, it's hard to create this kind of lovely, light, collaborative tone out of nowhere. But the skills, like anybody can do that, actually. Just a reflection and a good question. What could you do? Seem to get her there. All right. So before I open it up to Q&A, I want to tell you a little bit more about the research that I've been doing with my team at Boston Medical Center, and before that at Beth Israel, on these trainings, just because I'm very proud of it. I think it's interesting. So, we started in 2019 with a set of questions, which were, will caregivers want to learn these skills? Is it feasible to, and then in 2020, we said, well, is it feasible over telehealth? Can this program, like this kind of brief training program, help parents feel less stressed and better about themselves? Can it help families have less conflict? And also, are the effects durable? So, you can talk to somebody for an hour and feel great right afterwards. But then if you check in 3 months later, did that intervention have any durable effect that we can still see 3 months later? Okay, and so I'm going to kind of present data from some combined studies here. So altogether, we had 131 participants in these studies where, and all of them were family caregivers with an average age of 53, with kids ranging from 14 to 30. I actually think there was a couple older than 30, but that was about the range. And it was, there was a few parents in the mix whose kids were like, you know, procrastinating on college applications. But for the most part, these were parents whose kids were having a pretty hard time. 60% reported that their child had had at least one previous psychiatric hospitalization. So from a qualitative perspective, we asked people, well, what change have you noticed since learning the skills? A handful of people said no change. So I just want to put that out there. It's not for everybody. But here's some representative quotes that illustrate like what people had to say. So the children are willing to listen to me. Conversations are not as intense or volatile. I'm not criticizing. I'm trying to ask curious questions instead of judging. I'm having more productive discussions. I feel better about myself. My daughter feels validated and heard, which has decreased her acting out. So some of the themes when we looked at all of the responses in aggregate were like better communication, feeling better about yourself, feeling just more self-aware of like how you tend to react and being able to cope. And some people really reported, I think my kid's mental health is actually improving, but that was, you know, not, for the most part, the parents were focused on improvements for themselves, which was fine and great. It would be a big stretch to think that this would like, you know, necessarily help the young adult with a serious mental health problem. Though some parents did say that. Most of our participants, when we listened to their post-training audio, were pretty good at using the motivational interviewing skills, which was cool because they got, some of them participated in a group that met 4 times, some of them met 4 to 5 times with a therapist one-on-one, but it wasn't like a big, long training. And it was enough that most of the participants were pretty proficient in demonstrating the skills. Now, could they do it at home? I don't know. But what's interesting is that the people who didn't master the skills still said the training was helpful. So, you know, there may have been other things about it that were helpful to those people. And this is a chart with some of the more quantitative outcomes. So here's the 4 things that I was interested in for the caregivers was their level of stress, their confidence in themselves as parents, the level of conflict they were reporting day to day in their families, and something called expressed emotion, which is like, it's kind of like burnout. It's like, it's been studied in caregiving around like lots and lots of different conditions. Basically, it's like feeling like you cannot check out emotionally of this situation, and also that you resent it. And I think we've all been there as parents. I know I have. So it's a bad feeling. So what you're seeing here is on the left, these are aggregate mean scores before people came into the study. This is 6 weeks later after they did the coaching sessions. And then we followed up with people after 8 and 12 weeks. And what's cool is that, you know, the effects were highly significant, but also durable. You know, it wasn't like, okay, my stress went down or after I talked to Dr. Kline, but then it went back up because I hadn't talked to her in 12 weeks. It went down and it stayed down, which was very cool. And when it came to family conflict, it went down and then it continued to decrease, which was a cool thing to observe, that maybe as people practice the skills more, success builds on success in that arena. So the training seemed to help parents manage their role as caregivers to teens and adults who were struggling with their mental health. And so often that person who had the diagnosis was highly ambivalent about treatment, about therapy. But, you know, the parents were like, then the caregivers were really motivated to try something new. And that was just really cool to see. And just made me think like, wow, like what else could we do? I mean, NAMI is a perfect example, where you take the person who wants support and you get them, you know, in a room together. What would be helpful? So I want to offer some additional resources for those who are interested in this approach and want to learn more. And then we can open it up to Q&A. So the first resource I want to offer is this e-course that I created. So it's a MI for Families e-course. It's called the School of Hard Talks Online. It has this, if I could change one thing about it, it would be this atrocious URL. But if you Google School of Hard Talks Online, you should find it. It's totally free. It's like 7 little sort of bite-sized chunks that take about 10 minutes each. It's interactive. And it's not just like me talking. It's like I got to work with voice actors and real illustrators and everything. So it looks pretty cool. Just as a caveat, the families that are used as examples in the e-course are like, it's more like teenager focused, but the skills are the same. Another resource for those who are on Instagram is, I'm on Instagram at Learn About MILO, Motivational Interviewing for Loved Ones. And you can see, you know, just we kind of do like silly little reels. And then we also post little kind of flashcards like this. And we really started doing this because a lot of the parents we worked with said, oh, this was so great. And I'm definitely going to forget everything. So, you know, what's a way to kind of have little reminders or refreshers? And we thought, well, Instagram could be a good way to do that. So it's kind of an experiment that we're doing. It's definitely fun. It's a little embarrassing, but feel free to follow along. And then another resource is my book. So I have a book about all of this coming out in April, called The School of Hard Talks, How to Have Real Conversations with Your Almost Grown Kids. And again, the situations in the book, there's some that are about serious mental illness. There's some that are about, you know, drugs and alcohol, bullying, you know, all kinds of things. It assumes that the readers are like parents of maybe a little bit younger kids, like teens and young adults, but it's the same skills. Hopefully you'll find it helpful if you want to learn more. And if you want to read like the original motivational interviewing textbook, it's written for like clinical audience. It is a textbook, but it is excellent. I recommend it. It's called Motivational Interviewing, Helping People Change by William Miller and Stephen Rolnick. Okay, and then finally, please, you know, if you want to stay in touch, we're actually offering, just starting really this week, we hired a new psychologist on our team who's going to be offering MILO coaching sessions at BMC. So your child does not need to be treated at BMC for you to do this. If you want to come in and use your insurance to do a short-term kind of like sort of coaching or therapy with Dr. Pekchi, my colleague, she is offering that. And yeah, we're seeing, you know, if there's interest out there for that. So just get in touch with me and let me know if you're interested. And, you know, the way it would work is like you would come into BMC or over telehealth as a patient, and we would make a diagnosis of like an adjustment disorder, which just means that you are dealing with a really difficult situation and you're looking for some help with that. So I think, yeah, that's all of my slides. Thank you. And of course, I want to thank my team at BMC who's been, you know, obviously I couldn't have done all this myself. So I'm going to stop sharing my slides. And I don't know, John, if you want to kind of moderate conversation.
Yeah. So Folks, I think, Betsy, if we can stop the recording and perhaps we'll just go live if people have some comments or questions.